Thank you, Trina, for that introduction, and I'm delighted to be here to give you a short presentation on how you might reduce your cancer risk by participation in one or more of our population cancer screening programs. My name is Dr. Alan Smith, and I'm one of the consultants of public health medicine with the National Screening Service. So very quickly, we know internationally that there is substantial evidence showing that the introduction of population screening programs results in what we call a stage shift, where we see a greater proportion of earlier stage cases or cancers known as stage 1 and stage 2 amongst diagnosed cancers, avoiding those late stage and hard to treat cancers. It's also known that this earlier diagnosis results in improvements in survival time for an individual and for the population at large, a reduction in cancer mortality. I think probably the first thing I should do is introduce you to the three population screening programs that we have in Ireland. We have three of them: BreastCheck, the National Breast Screening Program, which targets women aged between 50 and 69. Cervical Check, the National Cervical Screening Program, which targets women aged between 25 and 65. And finally, we have Bowel Screen, the National Bowel Screening Program, which targets men and women aged between 60 and 69. And there are plans to expand that program down to 55 and upwards to 74. It's really important to understand that screening and participating in screening is not just a single test. I've highlighted here in green the actual screening test in the pathway, but this is how you should view participation in the screening program. It's a pathway of care. There are a number of steps before you actually do the screening test, and there are a number of steps and actions after you do the screening test. And you don't just go through it once. Depending on your age, you will be re-invited to participate in the screening program. It varies depending on which program we're talking about. But just remember that it's not a single test and it's on a loop so that you're re-invited to participate in the program. So what is it trying to do? It's trying to reduce your risk of getting cancer. So from your own individual perspective, it is about balancing up the benefits versus the harms, or the pros and cons. And really what you're doing in your head is weighing up risk. We know about the benefits, they're very clear, but equally, we're increasingly learning more about the possible downsides to screening, and these include false negatives, where you might be given a false reassurance, or indeed a false positive, where you might be exposed to treatment that you don't necessarily need. And of course, there are psychological effects of participating in screening programs. We know that. So this is a constant balance that you will be doing in your own head as to helping you come to a decision about whether I want to participate in the screening program. Let me give you a good example to try and answer that question if you're considering participating in Cervical Check. So this graph is taken from the National Cancer Registry Cancer Trends Report, published in September just gone. And you can see in the graph the shape of the line is clearly upwards, up to the point at which the green arrow appears there. And the green arrow indicates the point at which Cervical Check was introduced into Ireland. And you can see since then, the number of cases and the incidence rate of cervical cancer in Ireland has consistently and constantly decreased, of the order of 2.8% per year. That is significant. That is a lot of women, that is a lot of families who are benefiting from the existence of a cervical cancer screening program in Ireland. So what does that mean for you in terms of balancing up your decision? Well, we're seeing a stage shift towards a greater proportion of early stage cancers amongst all three programs. We're seeing improvements in survival time at an individual level. We're seeing reduction in cancer mortality rates in the longer term. And we know that each of these is an important criterion in terms of evaluating whether a population screening program is effective or not. So if you were to ask me, should I participate in screening programs? Well, ultimately, the decision rests with you, but based on the evidence that we have, participation in cancer screening programs in Ireland, namely BreastCheck, Cervical Check, and Bowel Screen, can reduce your cancer risk. So if you feel that you want to participate in the programs, you would be more than welcome, and we'd be delighted to see you in any of the programs. Thank you.